wonderful town.
You described a little bit about H1N1 and if someone didn't know anything about it, just what it's all about.
What we're experiencing right now is a brand new, never before seen in nature influenza type A virus called H1N1, formerly called swine flu, but we're starting to move away from that because that's not totally accurate.
Now, the question I hear is, at first people didn't know necessarily how far this was going to go, don't know, how big it can get. Do you know any better of an answer now than you did maybe a week ago of how far this can possibly go?
I think a couple of weeks or 3 weeks into this current outbreak of H1N1 influenza, we're seeing that it continues to behave in a way that's a lot like the seasonal influenza that comes and goes year in and year out. Although it is a brand new virus, it is appearing to be moderate to mild as influenza illness goes. So, we're not having a terrible concern about very, very ill people. And although we've seen deaths so far, there's no reason to believe we're going to see a lot of deaths.
I heard on the way over here on the radio a story about in Hong Kong. There's a person who traveled from Mexico to Hong Kong. They're staying in a hotel. The police now have the hotel quarantine. Is that going overboard at this point?
I think that a lot of what we're seeing is beginning to get into the overreacting arena. In other words, having police hold somebody against their will because they may have this virus. Schools closing out of concern that somebody might have been exposed to somebody with the virus. I think we're looking at perhaps disrupting normal activities in our communities a little too much at this point, based on what we know at this point.
You mentioned the schools closing, and I find that really interesting because you're watching ESPN today, and they're talking about 300 schools closing in Alabama and 400 in Texas. I mean, if someone comes to you and says, a school district, what should we do here? What precautions should we take? What are you saying to them?
We would like schools to work with local health departments if they have a question about whether they have a student that's ill or maybe ill or exposed, because public health can give a lot of guidance on what would be an appropriate level of response. Really in Michigan right now, there really is no reason for school systems to be closed down unless they have a child that is a suspect or a probable case of this particular H1N1 influenza. Then public health working with the school might decide it would be appropriate. But as of right now, I am not hearing that that's the case in any of our schools.
Now, all the people out there that are hearing about this pretty constantly, it's out there now. When you look at it based on the real, or not, I guess that's not the right word, but the original influenza that most people, the normal one that people would go through, how much does it differ in terms of the symptoms that you're going to have and how you're going to feel?
This current H1N1 influenza really is behaving very, very typically for seasonal influenza or the routine influenza that comes into our communities in the fall and winter. The one difference, of course, is this is coming at us at the end of the flu season. So the timing is atypical. The presentation, the symptoms of sore throat, cough, congestion, fever, fatigue, it looks like any other influenza that we typically see.
But this isn't the type of thing, from what I gather, you're saying that this isn't the type of thing where if you get it, obviously you want to go see your doctor, obviously you want to try to catch it early, but it isn't the type of thing where instantly you get it and it's this pandemic alert within yourself.
That's correct. I think that what we've seen, even in Mexico, is that there are probably hundreds and hundreds of people that contracted this infection that were ill but never even saw a doctor. They were miserable for a period of days and they got better. And that's exactly what typical influenza is like in any given year. Having said that this is a pretty normally behaving influenza, we have to also say that this is a brand new virus that we haven't ever seen before. So we have to monitor this cautiously because it may start behaving in ways that we don't expect.
one last thing, and that's the discussion of the surgical masks. They're flying off shelves from everything I hear. Is there any recommendation of a surgical mask? I mean, is that something that, my thought is if you're wearing it now, you might as well wear it always, right?
Yeah, that's a good point. Who needs to wear a surgical mask and why right now? The people that need to wear surgical masks right now would be individuals that may be face-to-face with somebody that is highly suspected of having this H1N1 influenza, or is a probable case, or is a diagnosed case of this influenza. That would be the person that needs to wear a mask. They're face-to-face with that person, and I'll give you a good example. Somebody coming into the emergency room ill with influenza-like symptoms. They were in Mexico last week. That would be a situation where a nurse and a doctor would don a protective mask.
Do you think we're at a point where there should be a discussion about not going to Mexico right now?
Well, I would mirror what the Centers for Disease Control and Prevention is recommending, and that is that unless you have essential travel needs to be in Mexico, it might be advisable to delay your departure or put off a trip to Mexico. That doesn't mean to say that you definitely should not go, because I think the risk of contracting H1N1 influenza in Mexico is pretty minimal, unless perhaps you're in Mexico, if you're in the big cities. If you're in Mexico City, and if you're going to be going and working in the hospital in Mexico City, that may be a different story.